Question 1. Which descriptive term best characterizes the cervical ridge on the buccal surface of the primary mandibular first molar? A. Smooth and continuous. B. Extremely prominent, especially on the mesial half. C. Non-existent, as in permanent molars. D. Divided by a central buccal groove. Correct answer. B. Explanation. The primary mandibular first molar has a unique and extremely prominent buccal cervical ridge, particularly on the mesial half. This bulging convexity is a major factor in pediatric restorative dentistry, making matrix adaptation difficult. Question 2. The permanent maxillary first premolar often features a deep depression that complicates instrumentation and restoration. This depression is located on the A. Distal surface of the crown, B. Mesial surface of the crown and root, C. Lingual surface of the root only, D. Buccal surface apical to the cervical line. Correct answer. B. Explanation. The mesial concavity that extends from the crown across the cervical line and onto the root surface, the canine fossa, is a highly distinctive feature of the permanent maxillary first premolar. This concavity often dictates preparation design and makes the tooth challenging to restore or perform endodontic access on. Question 3. Excluding the third molars, which permanent tooth is most frequently congenitally missing anodontia or hypodontia? A. Maxillary second premolar. B. Mandibular second premolar. C. Maxillary lateral incisor. D. Mandibular central incisor. Correct answer. C. Explanation. Congenitally missing teeth, excluding the unpredictable third molars, most commonly occur with the maxillary lateral incisor, often presenting as a peg lateral, microdontia, or complete absence. The next most common is the mandibular second premolar. Question 4. What is the approximate incidence of a second mesiobuccal canal, MB2, in the mesiobuccal root of a permanent maxillary first molar? A. 40%, B. 60%, C. 80%, D. 100%. Correct answer. C. Explanation. Endodontic access requires knowing this high-yield variation. The mesiobuccal root of the maxillary first molar has a very high incidence, reported as high as 80–90% in some studies, of having two canals, MB1 and MB2. This knowledge is essential for successful root canal treatment. Question 5. The primate space in the maxillary arch is located between which two primary teeth? A. Central incisor and lateral incisor. B. Lateral incisor and canine. C. Canine and first molar. D. First molar and second molar. Correct answer. C. Explanation. The maxillary primate space is located mesial to the primary canine. The mandibular primate space is located distal to the primary canine. These spaces are essential for the proper alignment of the succedaneous permanent teeth. Question 6. Which cusp is considered the smallest and sharpest of the 5 cusps on the permanent maxillary first molar? A. Distobuccal cusp. B. distolingual cusp, C. Mesiobuccal cusp, D. Mesiolingual cusp. Correct answer, B. Explanation. The permanent maxillary first molar has 4 main cusps and the cusp of Carabelli. The 4 main cusps, in decreasing order of size, are typically mesiolingual is greater than mesiobuccal, is greater than distobuccal, is greater than distolingual. The distolingual cusp is the smallest and sharpest of the primary cusps. Question 7. During a working side, laterotrusive movement, the opposing tooth contacts are guided by the A. Curve of Spee, B. Vertical dimension of rest, VDR, C. Canine guidance or group function, D. Centric relation, CR. Correct answer, C. Explanation. Working side contacts are dictated by the mechanism of occlusion. Canine guidance is where the canine disengages all posterior teeth immediately upon lateral movement. Group function involves multiple posterior teeth on the working side contacting simultaneously. Both are types of working guidance. Question #height. Which permanent premolar is most likely to exhibit 3 cusps, 1 buccal, 2 lingual? A. Maxillary first premolar, B. Maxillary second premolar, C. Mandibular first premolar, D. Mandibular second premolar. Correct answer, D. Explanation. The mandibular second premolar frequently presents in a 3-cusp form, known as the Y-groove pattern, with 1 large buccal cusp and 2 smaller lingual cusps, mesiolingual and distolingual. The 2-cusp form is less common. Question #9. Excluding the third molars, which permanent tooth has the highest propensity for impaction? A. Mandibular second premolar, B. Maxillary canine, C. Maxillary central incisor, D. Mandibular second molar. Correct answer, B. Explanation. The maxillary canine is the second most commonly impacted tooth overall after the third molars, due to its long eruption path. Early detection of a potential impaction is a critical element of patient management. Question 10. The crown of the primary maxillary second molar resembles which permanent tooth in its overall morphology? A. Permanent maxillary first premolar, B. Permanent mandibular first molar, C. Permanent maxillary first molar, D. Permanent mandibular second molar. Correct answer, C. Explanation. The primary maxillary second molar is often cited as closely resembling the permanent maxillary first molar due to its rhomboidal shape, 3 roots, and the presence of the oblique ridge connecting the mesiolingual and distobuccal cusps. Thank you for watching. Please subscribe and follow.